Hi everyone, today we are doing an upper face neurotoxin treatment. So going ahead and starting by marking up, I went ahead and marked my lateral borders for my frontalis, and then going ahead and estimating where I would like my injection points to be. It's always good to remember that these are just suggestions. We're never injecting straight through our markings, but just to give me a good idea of how I want to spread my product. Now going ahead and marking our corrugators, I always mark the tail ends just to ensure that I am staying within the corrugators. It's also important to remember that when we're treating our corrugators that frontalis lies right underneath. So when we get to that injection point, it's very important to maintain a good depth. But now we're going ahead and injecting. So I'm going across and using my initial points that I marked up here, just to ensure we're treating the entirety of that muscle, and we are always staying up above those brows just to make sure we don't have any heaviness or brow ptosis. Here we are treating the procerus, so I like to pinch and hold and place my product. Here I am placing my product deep. And again, as I mentioned, the corrugators, I always want to ensure that I am not treating the full depth of my needle to ensure that we are not causing any sort of brow heaviness and hitting that frontalis and causing a medial brow drop. So just going ahead and treating both sides. I like to pinch and hold just right underneath that brow for some support as I'm injecting. And here I did both a medial and a lateral injection point for her corrugators. Just going ahead and getting her cleaned up. I always instruct my patient to keep the area clean for the first 24 hours just to avoid any risk of infection. Now we are moving on to our crow's feet. I'm always pointing my needle away from the eye and treating very superficial. This is a superficial muscle, and it also provides safety that zygomatic major and minor are closer than you might think in this area, and we never want to affect the smile with these injection points here. So just facing away from that eye and staying superficial. I am treating in a tight dilution today, so this is what I have pulled up in my syringe, and I am just following the patient's movement as I go ahead and place my product. Again, just making sure I am staying superficial.